New at 6, we're hearing from a local doctor about possible side effects of a COVID-19 vaccine.
While not all of the data is in on the 4 leading vaccines, researchers say they're likely to come with more side effects than the typical flu vaccine that we're used to seeing. Fox 12's Brenna Kelly sat down with a local physician to learn more.
It's important to remember we will be seeing different versions of a COVID-19 vaccine come out. They will work differently and have different side effects. But overall, a doctor I spoke to today says none of the studies have shown any serious safety issues related to the vaccines.
It seems right after the question of will a COVID-19 vaccine work is what are the side effects and is it safe for me? Dr. Adam Brady, an infectious disease physician at Samaritan Hill Services in Corvallis, says these vaccines will likely have more symptoms than a flu vaccine.
You know, they're not necessarily side effects, but something called reactogenicity. So it's really your body's reaction to the vaccine itself. And those are the things like fatigue, headache, fever that can be severe in a few cases, especially with the Moderna vaccine.
Brady says it's important to have that expectation, but also know studies haven't shown any serious safety signals related to the vaccine so far. But what about people with underlying conditions?
We do know that in most of the trials, a significant proportion of people in them had medical problems as well. So once we have more complete data before approval, we'll be able to know exactly what those are and which medical conditions which groups of people with medical conditions, certain medical conditions should avoid the vaccine, and which it's been tested in and appears to be safe in.
There are a whole range of medical problems, from diabetes to a person battling cancer who may want the vaccine. Do we know about different risks?
Something like diabetes is traditionally low risk for vaccine issues than something like some forms of cancer or blood cancers and things like that, where we might worry a little bit more. But these are not live virus vaccines. It has no chance of replicating and causing infection. So again, usually those vaccines are a little bit safer even in those populations.
You may have noticed the vaccine trials paused for different illnesses and then restart again after determining it was safe to continue. Brady tells me this is a sign that the process is working. Reporting in Portland, Brenna Kelly, Fox 12 Oregon.